Esteemed doctors, colleagues, healthcare professionals, good morning, good afternoon, or good evening, wherever you are joining us from across the globe. A warm welcome to this industry session hosted by Gene Solutions at ISPD 2026. My name is Ida Deleskog-Lindström and I'm the Global Medical Affairs Director at Gene Solutions. We are very excited to present today's timely session on minimally invasive endometrial cancer triage using methylation to reduce unnecessary D&C biopsies in TVUS high-risk patients. Before we begin, I would like to briefly introduce our company. Gene Solutions is a global biotechnology company with operations in more than 20 markets worldwide and 17 next-generation sequencing laboratories. To date, we have performed more than 3 million next-generation sequencing tests, bringing world-class genomics closer to clinicians and patients across Asia, now expanding operations to Middle East, Africa, United States, and Latin America. Today, we are proud to expand our commitment to women's health with epiHERA, our novel methylation-based assay designed to support minimally invasive triage for endometrial cancer. It's now my great pleasure to introduce our two distinguished speakers. First, Dr. Jacqueline Lee, Clinical Associate Professor at the Chinese University of Hong Kong, and a leading gynecological oncologist. Dr. Lee will present on unmet needs in endometrial cancer detection and clinical validation of a CDO1 CELF4 methylation assay, epiHERA. Following, Dr. Lee will hear from Dr. Sergio Begaj, Medical Laboratory Director at Gnosis Laboratory in the United States. Dr. Sergio will share on his clinical practice experience and real-world application of the CDO1 CELF4 methylation assay. Before we begin, just a quick note that this session is being recorded for educational purposes. Questions can be submitted via chat or saved via Q&A at the end. Without further delay, please welcome our first speaker, Dr. Jacqueline Lee.
Good evening. I'm Dr. Jacqueline Lee. It's my pleasure today to share with you my presentation on unmet needs in endometrial cancer detection and a clinical validation of a CDO1 CELF4 methylation assay, which is used for endometrial cancer detection. So endometrial cancer is the sixth most common cancer globally and is the most common gynecological malignancy in developed countries. Symptoms include abnormal uterine bleeding, like intermenstrual bleeding, postcoital bleeding, or menorrhagia. So all of these symptoms overlaps a lot with benign gynecological conditions like fibroids or polyps, making it difficult to be differentiated from cancer. Usual investigations will be performed, such as transvaginal ultrasound scan, endometrial sampling, and hysteroscopy with uterine curettage. In this Hong Kong study done in the Prince of Wales Hospital in postmenopausal bleeding women, they used transvaginal ultrasound scans for endometrial thickness to see the risk of cancer. It's found that with a cutoff of 4 mm, the sensitivity of detecting endometrial cancer is quite high, it's more than 90%. However, the specificity is quite low, it's only around 60-70%. So this means that it can reliably exclude cancer if the endometrial thickness is thin, but then if it's thick, actually there's a lot of high false positive for cancer detection. So many of the patients with a thickened endometrial thickness actually doesn't have cancer, but they will still require invasive testing with endometrial sampling and also maybe hysteroscopy and uterine curettage. As for premenopausal women, there's actually no well-defined cutoff. So in this study with around 800 women, it's found that the endometrial thickness varies during the menstrual cycle, being thinnest during menstruation around 7 millimeters, and thickness at the luteal phase of around 11 millimeters. So I want to assess the endometrium. We either use hysteroscopy with uterine curettage, which usually requires some sort of anesthesia, or a pipelle endometrial aspiration, which doesn't require any anesthesia, but then you won't be able to look at the uterine cavity. So in this meta-analysis with 12 studies of 1,000 postmenopausal bleeding women, it's found that the sensitivity of endometrial aspiration for detecting cancer is actually quite high. If you use D&C as reference, it's around 100%. If you use hysteroscopy, it's around 90%. So even for atypical endometrial hyperplasia, the sensitivity is also quite good at around 90%. But then there's a problem with endometrial sampling in that it has a certain failure rate. For example, if the patient has a stenotic cervical os, and also there can be sampling insufficiency, especially in postmenopausal women. And in this kind of cases, there's still a chance of cancer around 7%, which cannot be diagnosed. So both endometrial sampling and hysteroscopy and D&C are invasive. It requires specialists and also pathologists, and therefore are rather expensive. So here comes DNA methylation. So DNA methylation contributes to control of transcription, which affects normal development, silencing of genes, and gene imprinting. Hypermethylation of genes and promoters inactivate tumor suppressor genes, causing carcinogenesis. So there are a lot of reported molecular markers for endometrial cancer detection, such as CDO1, CELF4 used in our study, and also other things like GYPC, that's again 12. So methylation studies can be done in almost any bodily fluid, like the blood, stool, urine, fecal scrapings, and DNA methylation analysis is shown in some cancers like breast cancer, colon cancer, liver cancer, lung cancer, to have a very high accuracy, more than 95%, in predicting whether it's a cancer or normal tissue. So the hypothesis for endometrial cancer is that malignant cells from the endometrium may shed to the lower genital tract of the perineum, where it can be identified in the urine sample, vaginal sample, and cervix sample. So blood as a sample is convenient, the acceptability is good, but then the tumor load may not be that high. As for urine, intravaginal tampon, it's convenient for urine, but then the tumor shedding in urine may be also a bit low. As for intravaginal tampon, it's less invasive, but then the acceptability of the patient is uncertain. Cervical scrapings is also less invasive than endometrial sampling, and this would be a clinician collected sample, which may be more reliable. As for uterine lavage and endometrial brush, this has also been reported for methylation assay infection of endometrial cancers, but then these are also actually still a bit invasive. So in this study with 45 studies around 6,000 women with endometrial cancers, it's found that an abnormal cervical cytology can be identified in endometrial cancer patients in around 50% of the patients. So indicating that some abnormality can be found in the cervical scrapings, but then of course the 50% sensitivity will not be very high. If the disease is more severe, like in higher grade or with deeper mammary invasion, of course the detection rate may be higher because there may be more endometrial cancer cells in the cervical scrapings. So DNA methylation tests for endometrial cancer detection have been studied in a UK study with 400 cases of them, around half of them has histology for comparison. And this study utilized Z-scan12 and GYPC region for the methylation. And it's found that compared to ultrasound scan, sensitivity is similar, around 90%, but then the specificity is much higher. And the positive predictive value is also much higher. So with increased specificity, less invasive tests will be required, and it can help to triage women with abnormal uterine bleeding so that not so many number of invasive tests has to perform, and also the result will maybe be faster than the pathology report. So this Taiwan study have performed similar stuff in 600 women with abnormal uterine bleeding more than 40 years old, and they use cycle-scraping DNA methylation at BHL, HD2, and CDO1 gene, and also incorporate age and also BMI into their calculation algorithm. And it's found that the sensitivity, it's around 90% of the methylation assay. Specificity is slightly low at 73%. And they comment that this methylation assay may reduce invasive testing in around 70% of patients. And here comes our study, a prospective evaluation of cervical scrapings CDO1 and CELF4 methylation assay in detecting endometrial cancer. So it's in Prince of Wales Hospital, including 675 women with abnormal uterine bleeding or suspected endometrial pathology on imaging, endometrial hyperplasia, or endometrial cancer. Cervical scraping for DNA methylation assay will be performed on CDO1, CELF4 genes, and it will be compared to endometrial histology. So the technique for getting the scraping is that the patient cannot be menstruating. Excessive mucus will be removed from the cervical os, and the bristle of the broom will be inserted to the cervical os in full contact with the atrial cervix, and the sampler will be turned clockwise for 5 times. So if the sample contains too many blood, it will be discarded and not used for testing. And it's found that the accuracy is quite high at 97%, with a sensitivity of 84 and a specificity of 98.8%. The false negative rate is 1.6%, which is quite low. So there are 7 false positive cases, and all of them still have some sort of pre-invasive problem like endometrial hyperplasia or cervical intraepithelial neoplasia. So when we look at the 630 patients, 30 patients with endometrial sampling performed, 25 of them had positive methylation assay, which is around 4% of the samples. And in that, 7 cases are false positive and 18 cases are true positive. And these cases requires further investigations. So the false negative rate is 0.8%. But bear in mind that these methylation assay, it can tell you whether the risk of cancer is high, but then still it cannot treat pathologies which may cause postmenopausal bleeding, such as endometrial polyps, which has to be managed by hysteroscopy. Therefore, the number of invasive investigations that can be reduced may not be this high. And it's found that endometrial thickness, which is of higher, and also high grade of glandular abnormality on smear, and also presence of endometrial hyperplasia, significantly affect the accuracy of the assay. So in conclusion, DNA methylation assay on cervical scrapings has around 84 to 92% sensitivity in detecting endometrial cancers with a false negative rate of 1.6%. It can act as a triage for invasive endometrial assessment, reducing the number of invasive endometrial assessment. However, it cannot treat other pathologies like endometrial polyps. So this is all I have today. Thank you very much.
Good morning from California, and thank you to ISPD and Gene Solution for the opportunity to present today. My name is Safedin Beychai, and I'm a medical director at Gnosis Laboratories in Irvine, California. I appreciate the opportunity to present about our test Eden DX, which is branded in the United States and the only non-invasive liquid-based cytology test in the United States used for early detection of endometrial cancer and as an alternative uh, to biopsy. Eden DX is branded in the United States as Eden DX and stands for early detection of endometrial neoplasia. It is the same test as epiHERA ordered by Gene Solution. A little bit about endometrial cancer. I know that previous speaker has also present. Endometrial cancer is the most common gynecologic cancer among women in the United States, and its cases are rising significantly. It is estimated that in 2026 will be more than 68,000 cases in the United States. We know that current procedural diagnoses are two, and that is a transvaginal ultrasound and endometrial biopsy. Transvaginal ultrasound is commonly used to assess the endometrial thickness, but its diagnostic accuracy in premenopausal and perimenopausal women is limited, although the test has a sensitivity of 83 to 100%. Specificity of this procedure remain low, ranging from even 24 to 72%. And this is due to the hormonal fluctuation that might cause the physiological variation in the endometrial thickness. On the other hand, endometrial biopsy remain gold standard for detection or diagnosis of endometrial cancer, but it is very well known that almost 10 to 30% of biopsies fail due to the insufficient tissue leading to delayed diagnosis of endometrial cancer. The procedure is invasive, painful, and sometimes risky. Eden DX is a CAP or CAP-CLIA accredited methylation-based molecular assay that detects endometrial cancer in non-invasive endocervical sample collected for routine cytological examination using brush or spatula or broom. Eden DX is non-invasive test used for early detection of endometrial cancer and as a triage alternative to invasive biopsy. Eden DX is not designed to replace the current practice of endometrial biopsy, but this is designed to act as a supportive test, especially to triage women at high risk of endometrial cancer, as shown in this slide. And you can see these are the women at high risk, women with a history of endometrial neoplasia, women with hereditary or hormonal risk factor, women with Lynch syndrome, pre and postmenopausal women that they take tamoxifen for breast cancer, and women with abnormal uterine bleeding, of course, women with a polycystic ovary syndrome, and obesity is also high risk for the endometrial neoplasia. Eden DX, again, is a molecular methylation assay specifically designed to detect hypermethylation in two genes, CDO1 and CELF4, that are very specific for endometrial cancer. With the high sensitivity and specificity as shown in this graph, you can see individually or combined, very specific for the endometrial cancer. And again, the test is and detecting actually methylation using methylation assay is very important to emphasize because methylation occurs in the early stages of diseases, practically before the disease have developed or before the symptoms are developed, meaning that could be used or leveraged as a good test for early detection of cancer. Or even it is designed for convenience, uses non-invasive sampling of cervical scraping using conventional endocervical brush or spatula broom. Similarly, used for collection of pap smear or liquid cytology. Collected cells simply are just placed in a liquid cytology or pap smear and then transported to the lab. The stability of the pap smear, as you know, is almost 30 days. And we offered the test to OBGYNs, pathologists, fertility clinics, primary physician care, oncologists, and women health, other health, women health providers. And again, it is validated as a methylation UCR, PCR on the QuantStudio 5 from Thermo Fisher. Very simple workflow, collected specimen in the thin prep, used for extraction of the DNA, bisulfite conversion, real-time PCR detection. Workflow is turnaround time is 3 to 7 days, but could be faster. Now I'd like to present the results from our validation. Again, this is a methylation assay validated in the United States as a LDT. A total of 187 patient specimens were tested for this study. Of these, 142 were thin prep and 45 were biopsy or FFPEs. The study was done in cases this is the only study that was done in cases or patient specimens from Singapore or China and from the United States. The study comprised of 80 cervical scraping specimens from liquid cytology and 40 biopsy samples. In addition, several biopsies, which I will show later, were also used for specificity and cross-reactivity with other cancers. The overall sensitivity as shown in here was 90.2 and specificity of 96.2 with a negative predicted value of 99%, making the test ideal to rule out the true negative results. It is worth emphasizing sensitivity of cases with a grade 1, as shown in here, and grade 2 with a sensitivity of 81.8% and sensitivity with grade 2 of 100%. Although this is not or study will continue with a larger number of specimens, this indicates that we can detect the early endocervical cancer as early as grade 1 and grade 2, which is very important as overall 5-year survival is greater than 95%. Again, indicating the sensitivity of the assay for early detection of endometrial cancer. Analytical sensitivity and adequacy of the assay. Analytical sensitivity or an LOD was done using mixture of cancer cells carrying both methylated genes and normal cells. Mixture was done in different dilutions or concentrations as shown in here, ranging from 0.5 to 100%. And as shown in these results, we were able to detect at 1% of cancer cells in a mixture of the population at the detection rate 60.7%. With 2.5 cancer cell percent detection at the rate 100%, which is very sensitive. And what that means, we are able to detect 2.5% of cancer cell population in the isolated sample from cervical scraping. On the adequacy study, we show that we can detect hypermethylation from lower specimen volume, and you can see we study it at 5 ml, 2 ml, 1 ml, and 0.5 ml, and the difference is very minimal, indicating that if necessary, we can test from smaller volume specimens. Reproducibility and repeatability. We do this study to show the consistency of the test and that reproducibility and repeatability doesn't depend from the environment, from the operator, from the run, between the run, or within the run, or between the days. The samples in multiples or replicates was performed by 2 or 3 different operators at different day, different run, and within the run, and no differences or minimal differences were seen, but within the range of less than 20% of CV or coefficient variation. Analytical performance on interferences and cross-reactivity. For the cross-reactivity assessment, we use weakly positive concrete scraping samples or liquid cytology spiked with different pathogens from the area, cervical or genital area. Most common pathogens like Gardnerella, Candida, Chlamydia, Trachomatis, Trichomonas vaginalis, and HPV. And in addition, we also evaluated potential interference substances, intrinsically and extrinsic substances, such as blood, semen, cleaning solution, different creams, most of the interference substances that could be found in that area for the interference with the specimen or the testing. And the spiking was done at different concentration and no interference was seen. So the positive specimens were positive regardless of the interference substances. Cross-reactivity with other cancer, cervical cancer and ovarian cancer, was also performed using 3 cancer specimens and 2 benign cervical cancer specimens in liquid cytology, and also 3 ovarian cancer biopsies and 2 benign ovarian cancer biopsies. And as you may see, all were negative, indicating that assay is very specific for endometrial cancer and doesn't interact with cervical or benign or ovarian cancer. Stability study, specimen stability was done, and test show stability for up to 7 days. Simply, there was not much difference between day 1 or day 0 and day 7, stored at the room temperature with a very small CV differences. We also designed a very simple and easy to read report with straightforward clinical interpretation for providers, showing clear results and further instructions. And this could be provided to upon request. Implementation in the United States. We again implement this test as a first LDT assay or test in the United States from pap smears or liquid cytology and biopsies. A lot of work has been done, and we'll need some more to improve the test for use of endometrial cancer detection. One of the major milestones that we have are we submitted a manuscript to Journal of Molecular Pathology, which is very good milestone. Also, we had a very good meeting with ACOG. We request to recommend the test as non-invasive tool for early detection of endometrial cancer, and also as a triage alternative to biopsy. And it was a very good meeting. Currently, we in the United States, as you know, we use CPT codes and ICD-10s or diagnostic code to meet the medical necessity to get reimbursed. It's It's an insurance-based reimbursement. And reimbursement has been very good, promising, based on the code that we use, which is 81401. We also got the approval for Z code from the MolDX, or Managed Care Government Insurance, to use it with a genetic CPT code to improve or increase the reimbursement, which is very good. We market the test to reference laboratories and pathology groups, which then market the test to their clients or patients. And also we do have we market or sell the test directly to oncology and OB/GYN groups and clinics, which then they use that for their patients, and also to primary care physicians. We know that epiHERA, which is the same test like ours, just branded differently, is already implemented in several countries, so it is available internationally. Last slide, but not least, key learning points from this presentation. Validated precision molecular testing can support less invasive early cancer detection pathways, especially in endometrial cancer in this case. EdenDX and epiHERA demonstrated consistent performance in endometrial cancer triage to invasive biopsy. Liquid-based cytology may enable streamlined sampling for both cervical and endometrial cancer detection. Of course, we use that in our lab. We offer both from the one sample, one vial, one stop, one shop. So we would do the testing for endometrial cancer and for cervical cancer. Broad clinical adaptation will depend, of course, on reimbursement support and test affordability, which we are working on it, and we'll continue working to make sure that the test marketed in the United States and globally is convenient for patients and for providers to use. Thank you for your attention, and I'll take any questions.
Thank you very much, Dr. Jacqueline Lee and Dr. Sadio Begash, for those excellent presentations. We will now move into short panel discussion and Q&A. And while we wait for questions to come in from the audience, I have a few focus questions for you. So for Dr. Lee, if I may begin with you, as the lead investigator of the prospective Hong Kong study, what do you see as the most meaningful clinical value of the CDO1 CELF4 methylation assay epiHERA in the detection of endometrial cancer?
I think the most important value is especially in patients where endometrial sampling is difficult. For example, in postmenopausal women, older women, where entry into the endometrial cavity would be difficult. For those kind of cases, epiHERA would be a very good option, because otherwise we may not be able to sample the endometrium. And also for some cases where the symptoms are not that worrying, but then the patient still has concern on endometrial cancer, then like the younger patients with only some irregular bleeding, not very frequent, but they still want to have a peace of mind that they are not having endometrial cancers, but they may not want a really invasive test, then epiHERA would also be a good option. But for patients like very symptomatic, higher possibilities of having endometrial pathology like polyps, even if it's not cancer, they may still require a hysteroscopy.
Thank you very much for your answer. So, Dr. Sadio, if I may move on to you. So, with the progress in the US, could you share an update on the reimbursement process for EdenDX powered by epiHERA, and how this supports broader access to epiHERA for patients in the United States? Oh, you're muted.
Yeah, as I said during my talk, in the United States is based on insurance-based reimbursement, which we use CPT codes and ICD-10, and the reimbursement has been very positive. And definitely we have to follow the criteria to get reimbursed, and we got the Z code, we got the genetic code, and we are planning to apply for our unique specific code, which will then increase the reimbursement in the United States. But definitely, we don't see any problem in reimbursement currently based on insurances, and some patients willing to pay uh, as a self-pay cash for the testing. So we see very much progress in the United States in the demand for the test.
And what about looking ahead? Are there any plans to pursue FDA clearance or approval for the test?
Yeah, that's the plan. We have a plan with INEX from Singapore to actually push the testing through the FDA. First, we most likely will apply for the breakthrough device through the FDA, and then plan the study to do it as a, I'm not sure will it be PMA or a 510K, but whichever the government requires, we will follow.
Well, that's very exciting news.
Yeah,
Thanks,
very
thanks for
exciting actually.
sharing.
Yeah.
That's excellent. So maybe Dr. Lee, one more question for you. What is the current global utilization of DNA methylation tests for endometrial cancer detection, and how do you see epiHERA contributing to wider adoption worldwide? If I may start with you,
I
Dr.
think that is a
Jacqueline.
I think that is a very promising test. So the problem is that we have to get more evidence so that it could go into the system. Once it is in some algorithms, like international guidelines or management algorithms, then people will start to use it. And also, I think that maybe not OBGYN, but a general practitioner would be even more tempting because they won't be performing endometrial sampling, but they sometimes may be performing pap smear. So if this simpler test would be available, then not a specialist input would be possible for detection of endometrial cancers.
Thank you very much. And Dr. Sadio, do you have anything to add to that?
Yeah, I
So
think
with
it's very good in the cervical sampling to be used for endometrial and cervical cancer. Perhaps at the same time, physician can screen or look for both for detection of both cervical and endocervical. And we use that. We actually market that in the United States to offer to physicians like a convenient to collect the specimen for both endocervical and endometrial cancer.
Thank you very much. And Dr. Jacqueline, do you have any questions for Dr. Sadio? Or Dr. Sadio, do you have any questions you would like to ask? Dr. Jacqueline?
I don't have any questions.
My question would be some kind of statistic, how many countries or what's the utility of this, say, abroad in Asia, for example, and I know that you are planning to launch in Middle East and maybe, in Europe. So we can kind of get an idea the utility of the assay globally. If
Yeah, that
IDA
would be
or Gene Solution
that would be
has.
very interesting to have that data. Yeah, I agree. Yeah.
Because
So
it's a really good test that should be used worldwide, not just in the United States, Singapore, and Vietnam. Should be used globally. It's a really good test that can really, if you use it right for the right risk, patients can actually not just detect, prevent, or detect early, so can be managed properly.
Yeah, no, thank you very much for that comment. Yeah, I think there's a lot of work to be done, and as Dr. Jacqueline Lee were mentioning, with more evidence and especially with guidelines and reimbursement is going to be very important for adoption worldwide. But there's a lot of
We'll continue our work to
potential.
make that happen.
Yes, thank you. Thank you very much. So thank you very much, Dr. Jacqueline Lee and Dr. Sadio, for your very insightful presentations and valuable insights today, and all of you for joining us today. So epiHERA, CDO1 and CELF4 methylation assay, epiHERA offers a promising, minimally invasive approach that may help to improve the diagnostic pathway for endometrial cancer, potentially reducing unnecessary invasive procedures while supporting more confident clinical decision-making. Thank you very much again, and wish you all a very enjoyable rest of ISPD 2026. Thank you.
Thank you as well. Thanks, everybody.
Thank you.